Hello everyone, wherever you are watching me from, welcome to my channel. Today I'm going to talk about anemia in pregnancy. According to WHO, it was estimated that 37% of women are affected with this condition globally, which is account for 32 million women worldwide. So let's talk about this because it can be you, it can be me. But before I delve into the topic, don't forget to like my video. Don't forget to subscribe for your support. And if you have any concern concerning this issue, make your comment, which I will attend to. Welcome back to my channel. To my returning subscribers, welcome back and God bless you. And if you are viewing my channel for the first time, I welcome you to my channel as well. My channel is all about enlightening individuals about some health challenges, most especially women, about some conditions which need to be managed appropriately to prevent complication. And if you are viewing me for the first time, I welcome you. Don't forget to subscribe to my channel as well. Today, I'm going to talk about anemia in pregnancy. What is anemia? Anemia is the reduction in the red blood cells and the hemoglobin level, which results into reduction in the oxygen capacity of the blood to carry oxygen to the body's organs and the tissues as well. Type of anemia. Anemia can be as a result of iron deficiency, folate deficiency, or vitamin B12 deficiency. These are all nutrients that constitute to the formation of blood. Moving on to the risk factors that prone or predispose women to anemia during pregnancy. Number one is genetical inherited disorders such as sickle cell disorder. Because of the sickle shape of the red blood cells, it's prone it to easily break down, result into half lifespan of the red blood cells. These can actually predispose the person with sickle cell disease into anemia in pregnancy. Another inherited disorder that can cause anemia in pregnancy is thalassemia, abnormal reduce in the hemoglobin level. Any person with this condition can actually predispose them to anemia in pregnancy. Number two is multiple gestation. For a woman that is carrying more than one baby, we are carrying a multiple if you are having a multiple gestation, because the woman need blood supply and the babies in utero will also need blood supply as well. That is what they depend on during pregnancy. So this woman will need more blood supply, and this can, if the woman did not have enough blood or having an underlying issue, it can result in anemia during pregnancy. Another thing is infection. Maybe infection before delivery, or perinatal infection, or postnatal infection. Infection can actually cause anemia in pregnancy or after the delivery of the baby. Another thing is when there is procedure such as gastric bypass, because of those nutrients that constitute to blood formation are absorbed in the intestine. So when there is any alter or removal of any part of the gastric, maybe intestine, where the area whereby the vitamin B12 is being absorbed is affected, it can actually result into anemia in pregnancy. Bleeding is also a factor for anemia. Maybe bleeding during birth of a child or after the delivery. This can result into anemia in pregnancy. These are some of the risk factor for a risk. These are some of the risk factors for a woman to have anemia, or predispose a woman to have anemia in pregnancy. Signs and symptoms of anemia. What an individual will experience when they are having anemia. Number one is fatigue. The person will feel tired, that you've been thinking about what is causing you to feel tired as such. Number two is pallor. The skin will look pale, that in a moderate or severe case, it will be visible for others to see that the skin is pale and the fingernails, you see that is pale. Number three is breathlessness because of the reduction in the oxygen capacity. But in some cases during the third trimester, because of the enlarged uterus abdomen, which is when a woman lie with their back, the abdomen may be pushing on the pulmonary organs. That is why it's advisable during the third trimester for women to lie on either their other side, any and not to prevent lying on their back. But in anemia case, even if the woman is lying on her side, even if she is sitting down in a resting position, she will still feel breathless because of the reduction in the oxygen capacity. In a moderate or severe case, the woman can feel dizzy, not because she has not eaten. Another thing is she will feel puffy, retaining fluid, not only in the leg, that will be visible in the extremity because of the reduction, shifting of fluid. How to manage anemia in pregnancy, or how to prevent the condition or avert any complication that can arise as a result of anemia in pregnancy. Number one is for the woman to book on time. The pregnancy duration is 40 weeks. It can be less than that period or more than that period. But if the woman has been detected earlier, all things needed to be done will be done to prevent uh, to prevent her having anemia till the time of her delivery. So the woman will be reviewed and managed appropriately, and they will be evaluating her any progress that she has made. Another thing is diet counseling. If there is dietitian available where you book, you can be reviewed by the dietitian to actually counsel about diet, how to eat right, what you have to eat during pregnancy. So it's so important. Another thing is supplementation. Mostly there is recommended dosage of iron, vitamins for women during pregnancy. So if you book and book on time, with these the anemia can be corrected before you go into labor. Another thing is to prevent bleeding, perinatal bleeding. Don't push against on fully dilated cervix. Listening to the instruction of your midwives. If you are not being instructed to push at the second stage of labor, don't push against a cervix that is not fully dilated. This can cause bleeding, which can result into anemia postpartumly. Another thing is now prevention of infection even after, during and after the delivery. So make sure you know where you book, make sure you know the hospital where you book to prevent any infection, perinatal infection, and also yield to the counsel and the instruction of your healthcare provider to prevent infection postpartumly is very, very important. Another way to manage this is that if there is severe anemia, the woman can be transfused with blood blood. So it's so important, if you have your belief or conviction is for you not to take blood, please follow all other management procedure, like book on time, book in a good hospital. Number two, prevent bleeding, don't push against the cervix, and also prevent infection, perinatal and postnatal infection, so that you can actually avert any condition that can result into blood transfusion according to your belief. It's so important. What is now the complication of anemia if it's not being detected, prevented, or managed appropriately? Number one, it can result into preterm labor when you are not ready. the woman can go into labor before time. Number two is low birth weight baby. So this is a risk to the baby. For a baby with low birth weight have their own consequences even after birth. It's a long-term consequence for them if care is not taken. Another thing is maternal mortality can actually happen because of anemia. So it's so important to take charge of your own health. So take complete charge of your health. I've come to the end of the video. Thanks so much for staying with me to the end. Don't forget to like, subscribe, and if you have an issue concerning anemia, make your comment. I will attend to it. Until next time, I'm doing another video. Bye. Take charge of your health.